32,000 cases of COVID-19 in a week may sound scary, but COVID-19 in 2023 is not what it was in 2020. My name is Eong. I'm a professor in emerging infectious diseases in the Duke-NUS medical school. There's been a lot of questions lately about whether COVID is coming back. There's now a lot more cases, 32,000 last week compared to earlier parts of this year. We are in a very different situation from 2020 because now most of us have been vaccinated and also been infected. Whereas in 2020, without vaccination, the fatality rate of COVID-19 at that point was about between 2 to 3%. 2 out of every 100 people who get COVID will die from this disease. Right now, that rate of death is less than 0.1%, actually lower than that because not all of us are testing. So we're in a much better situation now than in 2020. COVID is still a concern, just as influenza is a concern, just as pneumonia is a concern. During this holiday season, when we are meeting with friends, family, and potentially some people may be ill and therefore put those who are more vulnerable at risk. So it's not just when you test positive for COVID, then we put on a mask, then we stay at home. I think the same rules should apply for influenza, for other viral respiratory infections. So whilst COVID should be on our radar, it should not be the only thing that concerns us. Unfortunately, COVID-19 is here to stay. We're not going to eradicate this disease. We're not going to eliminate this virus. And so what we're living through now is probably what will be happening for the foreseeable future. The only thing that's still a little bit uncertain is the seasonal pattern. We can expect surges in COVID-19 cases and there are periods where there's a lull. Those who are vulnerable to severe COVID, such as those who live with chronic diseases like diabetes, heart disease, cancer, immunosuppressive disorders, the answer is definitely yes. The boosters will benefit because that's what you need to protect against severe disease when your immune system cannot react as optimally as it should. For those who are otherwise healthy, that probably is not needed. Public health is about social responsibility, and that social responsibility, at least for those who live with people who are vulnerable, may include booster vaccination. But that's a personal decision. But nonetheless, I think the guiding principle should be that we protect one another.